Which of the following medications is commonly used to manage fluid balance and prevent fluid overload in patients with AKI after cardiopulmonary bypass? A. Furosemide, loop diuretic. B. Morphine. C. Spironolactone. D. Vitamin D supplements. Answer: A. Furosemide, loop diuretic. Explanation: Furosemide, a loop diuretic, is commonly used to manage fluid balance and prevent fluid overload in patients with AKI after CPB. It helps promote diuresis and reduce excess fluid in the body, although it should be used cautiously, especially if renal function is severely impaired. Which of the following strategies is most likely to help prevent AKI in patients undergoing cardiopulmonary bypass with diabetes? A. Tight glucose control during surgery. B. Use of low-dose insulin preoperatively. C. Avoidance of diuretics in the perioperative period. D. Preoperative initiation of renal protective agents like ACE inhibitors. Answer: A. Tight glucose control during surgery. Explanation: Tight glucose control during surgery is important for patients with diabetes to reduce the risk of AKI. Hyperglycemia during the perioperative period can worsen renal function by promoting inflammation and vascular dysfunction. Maintaining blood glucose levels within a target range can help mitigate these effects and reduce the risk of kidney injury. Which of the following is the primary benefit of using a closed-loop perfusion system in patients undergoing cardiopulmonary bypass? A. Improved oxygen delivery to the kidneys. B. Reduced inflammatory response and renal injury. C. Better control of fluid balance. D. Increased blood pressure regulation during surgery. Answer: B. Reduced inflammatory response and renal injury. Explanation: A closed-loop perfusion system reduces the inflammatory response and oxidative stress associated with traditional CPB circuits. By minimizing the exposure of blood to non-biologic surfaces, closed-loop systems help decrease the activation of the immune system and reduce the risk of renal injury during CPB. Which of the following is a potential long-term consequence of AKI following cardiopulmonary bypass in patients with pre-existing cardiovascular disease? A. Reduced risk of coronary artery disease progression. B. Increased risk of recurrent AKI and end-stage renal disease, ESRD. C. Improved cardiac function and recovery. D. Decreased risk of postoperative stroke. Answer: B. Increased risk of recurrent AKI and end-stage renal disease, ESRD. Explanation: Patients with pre-existing cardiovascular disease who experience AKI after CPB are at higher risk for recurrent episodes of AKI and progression to end-stage renal disease, ESRD. The combination of renal and cardiovascular dysfunction can lead to long-term renal complications and poorer outcomes. Which of the following is the most important factor in predicting the recovery of renal function in patients with AKI following cardiopulmonary bypass? A. Age of the patient. B. The severity of initial renal injury. C. Type of anesthesia used. D. Duration of surgery. Answer: B. The severity of initial renal injury. Explanation: The severity of the initial renal injury is the most important factor in predicting renal recovery. Patients with more severe renal injury, e.g., prolonged ischemia, high levels of biomarkers like NGAL, are less likely to recover full renal function. Early identification and appropriate management of AKI can improve the chances of recovery. Which of the following interventions has shown to decrease the incidence of AKI during cardiopulmonary bypass? A. Use of high-dose corticosteroids. B. Use of low-dose vasopressors. C. Use of continuous venovenous hemofiltration during surgery. D. Use of pulsatile perfusion rather than non-pulsatile perfusion. Answer: D. Use of pulsatile perfusion rather than non-pulsatile perfusion. Explanation: Pulsatile perfusion has been shown to reduce the incidence of AKI compared to non-pulsatile perfusion. Pulsatile flow mimics natural heartbeats, improving renal blood flow and oxygen delivery to the kidneys during CPB, thus protecting them from ischemic injury. Which of the following interventions is most effective in managing fluid overload in a patient with AKI after cardiopulmonary bypass? A. Restricting fluid intake and using diuretics. B. Continuous hemodialysis. C. High-dose intravenous corticosteroids. D. Inhaled nitric oxide therapy. Answer: B. Continuous hemodialysis. Explanation: continuous hemodialysis is often the most effective intervention for managing fluid overload in patients with AKI following CPB, especially when kidney function does not recover sufficiently. This approach allows for controlled fluid removal and correction of electrolyte imbalances that diuretics may not fully address. Which of the following clinical parameters is most closely associated with poor renal outcomes after cardiopulmonary bypass? A. Hypotension during CPB. B. Hypertension during surgery. C. Blood glucose fluctuations. D. Use of antifibrinolytics. Answer: A. Hypotension during CPB. Explanation: hypotension during cardiopulmonary bypass is closely associated with poor renal outcomes. Inadequate blood pressure can lead to decreased renal perfusion, resulting in ischemic injury to the kidneys. Maintaining adequate blood pressure during surgery is critical for preserving renal function. Which of the following markers is most commonly used to assess the severity of renal injury in patients undergoing cardiopulmonary bypass? A. Serum albumin levels. B. Blood urea nitrogen, BUN. C. Serum creatinine. D. Urinary sodium concentration. Answer: C. Serum creatinine. Explanation: serum creatinine is the most commonly used marker to assess renal function and the severity of kidney injury. However, it may be less sensitive in the early stages of AKI, which is why newer biomarkers like NGAL are also being used to detect renal injury earlier. Which of the following factors is least associated with the development of AKI after cardiopulmonary bypass? A. Pre-existing chronic kidney disease. B. Duration of aortic cross-clamping. C. Use of an oxygenator with a biocompatible surface. D. Use of a higher flow rate during CPB. Answer: D. Use of a higher flow rate during CPB. Explanation: a higher flow rate during CPB is generally not associated with an increased risk of AKI. In fact, maintaining an adequate and stable flow rate can help ensure renal perfusion. The more significant risk factors for AKI include pre-existing kidney disease, prolonged aortic cross-clamping, and non-biocompatible surfaces in the CPB circuit.